My name is Shannon Allen. I earned my bachelor's degree in psychology at Arizona State University and am currently enrolled as a graduate student in their Family and Human Development program. Today I'm going to discuss the importance of moving towards a multidisciplinary approach to mental health and pathways to the integration of mental health and physical health care services. Beginning in the mid-1960s, a polarizing divide occurred between mental health practitioners who supported the biological medical models and those who supported the psychodynamic behavioral models for the diagnoses and treatments of mental illnesses. The biomedical side argued that biological medical models were more quantifiable than psychotherapy, that medication offered quick relief and reduced the demoralizing effects of mental illness, and that medicinal treatment was more systematic, where psychotherapy relied on the therapist's discipline. Psychobehaviorists argued that psychotherapy focused on healing the psyche, while medication only treated symptoms. In addition, psychotropic drugs could have pervasive side effects and could lead to dependency, and the sobering effects of medication would discourage individuals from wanting to participate in psychotherapy. This polarization was so pervasive that it often resulted in the inadequate and fragmented care of patients. Fortunately, during the last decade, advances in neuroscience and psychotherapy have led to a more integrated approach to mental health. A common realization among practitioners that bridge the gap between different disciplines is that humans are complex beings. Mental health issues are multidimensional. They may culminate from biological, genetic, or chemical abnormalities, individual, contextual, or environmental influences, or both. Therefore, a multidisciplinary approach to mental health is the most advantageous. Though theoretical and ideological positions have become less egocentric and have embraced more integrative approaches, logistical boundaries still exist. Each year, 1 in 5 adults will be diagnosed with a mental disorder. 3 of the top 4 disorders, anxiety disorders, major depressive disorders, and bipolar disorder, are effectively treated with both medication and psychotherapy. One of the primary differences between psychiatrists and psychologists is that psychiatrists hold a medical degree, which allows them to prescribe medicine. While the number of clinical psychologists are growing, unfortunately, the number of participating psychiatrists in the United States are declining. There are currently 4,000 communities in the United States with only one psychiatrist to serve 30,000 citizens. However, according to the American Psychological Association, by successfully completing a rigorous curriculum and training program, psychologists can obtain prescribing licenses. Unfortunately, these programs are only offered in 2 states. Before a psychologist can even qualify for prescriptive training, they must first be a licensed psychologist, which generally requires a doctorate, 1,500 to 6,000 hours of supervised clinical experience, and they must pass a national exam. Only then will they be allowed to enter prescriptive licensing programs. Depending on the state, they may be required to also have a postdoctoral master's degree in clinical psychopharmacology, 450 hours of didactic instruction, 400-hour supervised practicum, 14 months of supervised clinical rotations, and pass a certified exam in psychopharmacology. Currently, the population of prescribing psychologists is small, with only New Mexico and Louisiana offering prescriptive licensing for psychologists, and with a shortage of psychiatrists. The job of prescribing psychotropic medication is, more often than not, the responsibility of primary care physicians who have not received the same extensive training in the diagnosis and treatment of mental disorders that psychologists and psychiatrists have. As public health infrastructures expand to meet public demand, psychological inclusion is largely underdeveloped. Physicians are progressively compelled to analyze and treat mental and behavioral issues that they are not trained to. Coexisting mental disorders such as depression and anxiety can worsen the symptoms and progression of chronic diseases like heart disease, obesity, epilepsy, cancer, and asthma. In addition, the immune system can be compromised by stress related to psychological disturbances. Due to the high volumes of patients seeking mental health care with primary care providers, primary care is an opportune setting for the integration of mental health practitioners who can detect, diagnose, treat, and supervise mental health problems. Psychological inclusion in primary care can lead to an overall improvement in patient health. As advancements in the diagnosis and treatment of mental disorders continues to become more sophisticated, it is essential that mental and public health professionals do not regress but continue to work towards a more integrated system. From 1991 to 1997, the Department of Defense, in response to a shortage of military psychiatrists, implemented the Pharmacological Demonstration Project, or PDP. The educational and training modules for the PDP were customized specifically to meet the objective of training military psychologists to become competent in psychopharmacological treatment methods. The educational and clinical requirements for licensure under PDP were similar to those in New Mexico and Louisiana. Military psychologists receive their training at military hospitals. If healthcare professionals could advocate for a civilian public health system similar to the PDP under a nationalized and standardized initiative, it could relieve the burden on primary care physicians throughout the United States, who are currently responsible for the majority of psychotropic drug disbursements. Medicine of any sort can affect behavior. Therefore, expert knowledge of pharmaceuticals would be advantageous to any psychological practice. In addition, the implementation of such program could improve mental health care for those suffering from mental illness by having one provider who can assign both medicinal and psychotherapeutic treatments. Lastly, integrating psychologists with prescriptive licensing into primary care settings can ensure that patients are receiving well-rounded, convenient, and thorough care. According to an analysis of the Pharmacological Demonstration Project, prescribing psychologists were found to provide safe and high-quality psychopharmacological care with excellence. The integration of mental health services and primary care will allow healthcare systems to respond to multi-leveled aspects of health: psychological, physical, and social. In addition, integration can improve the patient's quality of care and access, and it's cost-effective. Multicultural competencies that psychologists possess offers an important benefit to overall healthcare. Psychological primary care integration has demonstrated expedited treatments, lower misdiagnosis rates, and reduced depressive symptoms in patients. Psychological services in primary care assume an integral role in the diagnosis, prevention, treatment, and management of chronic illnesses such as cancer, heart disease, and chronic respiratory disease. In rural and underserved areas where mental health facilities are sparse, integration will allow greater access to mental health services. In some cases, primary care patients diagnosed with psychological ailments may be reluctant to follow up with psychologists due to the stigma associated with mental illness. Integration will relieve the stress associated with this stigma. Psychologists are well versed in evidence-based treatments, which has been proven to improve mental and physical health. Psychologists, especially health psychologists, are proficient in mental and physical treatment adherence and compliance, which reduces hospitalizations. Fewer hospitalizations can save patients 20% to 40% in healthcare costs. Health psychology as an emerging field could help bridge the gap between public health care and mental health care. Public health psychologists often work in medical settings and provide services such as stress management, relaxation techniques, biofeedback, strategies for coping with disease, illness, or injury, preventative health behaviors, compliance with treatment plans, and psychotherapy. Most health psychologists are trained in the biopsychosocial model in areas such as HIV, psychosomatic illnesses, and oncology. In addition, they are well versed in the multidimensional framework that includes cultural, social, and psychological factors of disease processes such as diabetes, cancer, chronic pain, heart disease, and sleep disorders. This concludes my presentation. Thank you for watching.